Evidence-based practice, or similar terms such as evidence-informed practice or evidence-based medicine, come up a lot in healthcare. But what does evidence-based practice actually mean? And how can we as clinicians do evidence-based practice? On a practical level, using evidence-based practice could mean abandoning outdated practices and choosing more effective, scientifically validated methods to meet individual patient or client needs. If evidence-based practice is used consistently, optimal patient or client outcomes are more likely to be achieved. Since the most difficult type of knowledge for clinicians to collect and integrate into the clinical practice is often research evidence, the rest of this video will focus on this knowledge stream. However, I want to stress that clinician, patient or client, and research knowledge streams are all very important to the evidence-based practice process. Using research evidence means that clinicians who work using evidence-based practice must find, then appraise, the quality of research to determine its value for their specific patient or client population. Both the step of finding relevant research and appraising its quality take time and skill. However, there are tips and tricks that will make finding relevant, high-quality research evidence easier. First, let's consider finding relevant research evidence. What is helpful here is to first consider carefully what question you need to answer. Then determine what type of research evidence is the most relevant to that question, instead of looking for anything and everything. This evidence pyramid can help us figure out what evidence is most relevant to us. Specifically, what this evidence pyramid is telling us is that the higher up the pyramid, the more tailored and summarized the research evidence is. This process of tailorizing and summarizing makes the evidence more relevant for use in clinical practice. So, you should always try to start at the top of the evidence pyramid when looking for research evidence, and work your way down if needed. At the very top of the pyramid is systems, which refers to computerized decision support software via electronic medical records. This takes algorithms developed by data scientists to work. While this may be in kinesiologists' future, we and most other healthcare professionals do not have access to this source of evidence yet. Next, we have summaries, which includes clinical practice guidelines, clinical measurement tools and tests, such as the PAR-Q, 6-minute walk test, or the 1RM, as well as patient decision aids. Patient decision aids are used to help people become more involved in decision-making by making explicit the decision that needs to be made, providing information about their options and different outcomes, and by clarifying personal values. Following summaries are synopses, which outline and critically appraise research evidence found further down the pyramid. Next, there are syntheses or reviews, which synthesize primary studies in which new data is collected or analyzed in a new way. These primary studies then make up the bottom of the pyramid. So, knowing this, it is clear that we should first focus our attention on summaries and synopses. Where to find this type of research evidence is not always clear. However, we have provided a list of some good places to start looking. Something I do want to highlight here is that you'll find no research databases in this list. Searching research databases is important when research that is more relevant or higher at the top of the pyramid cannot be found. Once you know summaries or synopses don't exist, then you may need to start looking in research databases for information further down the pyramid regarding syntheses and primary studies. Now that we know what kind of information to look for, how do we know if what we have found is any good? Well, we need to appraise its quality. For almost any type of summary or synopses, what you want to look for to confirm that you should trust the information is that the authors use a knowledge synthesis as opposed to primary studies only in the development of that information. Also, the team developing the information was composed of researchers, clinicians, as well as patients or clients. It also helps when the team or affiliated association with the clinical practice guideline has a history of expertise in that area. For example, Diabetes Canada publishing clinical practice guidelines for exercise for people with diabetes is a good indicator for the quality of those guidelines. The one type of summary where this approach to determining quality differs is for clinical measurement tools and tests, which have a very different set of standards to determine if they are reliable and valid for use with certain populations of patients and clients. We will discuss this in more detail in another video. Since measurement tools and tests are so essential to the work of a kinesiologist, we need to know what to consider to select the right one for the right person. Otherwise, critical appraisal of reviews and primary studies is a tricky business. This is because each type of study is different, and thus each type of study requires different things for it to be considered high quality. For example, randomized controlled trials, or RCTs, are considered the highest quality primary study evidence available because of their rigorous design. They can contain extremely good information concerning the effectiveness of a program, such as a fall prevention program. However, a rigorous design also means a very complicated design. RCTs require many key decisions that must be made concerning included participants, data collection and analysis, as well as a host of other things to decide. Authors of RCTs or other studies do not always make the best design decisions. To help determine if researchers conducted a high-quality study, you can use the guidelines available from the Joanna Briggs Foundation, or equally the guidelines available from the Critical Appraisal Skills Program, to help guide you in the critical appraisal of all different kinds of studies. If you find yourself in a situation where you have to critically appraise research evidence lower down the pyramid yourself, then I really recommend you use these as guidance. To conclude, I would like to really drive home a point that was simmering under the surface throughout this video, and that is that research evidence isn't just confined to primary studies and reviews. Instead, research evidence encompasses a variety of other forms of information that is written for use for clinicians specifically instead of for use by researchers. As clinicians, we should work smarter, not harder. Use the research evidence in the form of clinical practice guidelines or clinical tests that someone has made relevant for your use and practice, instead of going back to the studies and reviews to redo the work that someone else has already done.